I'd like to talk for a moment about one of the biggest advances that is happening in the field of lung cancer, and specifically in the management of non-small cell lung cancer, the most common subtype of lung cancer in the US and around the world. For the last couple of decades, we have seen a revolution in the benefits that we can achieve for patients with advanced or metastatic disease. And we have far more patients who are living years when 20 years ago, we could routinely only expect to have people live for months and get a pretty modest benefit from chemotherapy alone. Instead, now with the benefits of targeted therapies for a subset of patients with defined molecular targets and immunotherapy for many other patients, we can have more and more patients with advanced disease respond with great shrinkage and have this benefit last for potentially years at a time. What the latest advance is moving some of these newer treatment approaches into earlier stage and potentially curable disease. So patients with stage 1 or 2 or 3 lung cancer, which we generally treat with curative intent but have mixed results with, can we improve outcomes by adding some of these advances from advanced disease, the targeted therapies, the immunotherapy? And these studies are just beginning to read out and lead to new treatment options for many of our patients as a treatment approach before surgery or after surgery, sometimes both. And for patients who may have locally advanced disease that is not optimally treated with surgery, maybe after chemo and radiation, adding immunotherapy, and in the near future, potentially targeted therapies. These are some of the biggest advances that we've seen just in the last few years, and we are continuing to see more and more exciting work being done. I expect that we will have more patients be cured of their lung cancer over the next decade and beyond from the advances of bringing these more effective systemic therapies and adding them to our old standards of chemotherapy, surgery, radiation.